Good morning, my name is Dr. Jeremy McAnulty from New South Wales Health, and I'm here to give you an update for COVID in New South Wales on the 30th of October 2021. There were 236 locally acquired cases of COVID reported in the 24 hours to 8 o'clock last night. In the same period, there were more than 77,000 COVID tests reported. In terms of vaccination, there are now 93.5% of people aged 16 and over who've had one dose of COVID vaccine, and 87% who are now fully vaccinated. In the 12 to 15 year age group, 79% have now had their first dose, and 58.5% have had 2 doses. In terms of hospitalisations, there are currently 343 people with COVID admitted to hospital in New South Wales, with 81 in intensive care, 33 of whom require ventilation. Of the people in ICU, 67 are not vaccinated, 6 have received their first dose of COVID vaccine, and 8 people have received 2 doses of vaccine. And sadly, today we're reporting the deaths of 3 people with COVID. A man in his 40s from Newcastle died at John Hunter Hospital. He'd received 1 dose of COVID vaccine and had underlying health conditions. A man in his 60s from Western Sydney died at Royal Prince Alfred Hospital. He'd received 1 dose of COVID vaccine and had underlying health issues. And a man in his 80s from southwestern Sydney died at Liverpool Hospital, where he had acquired his infection. He'd received 2 doses of COVID vaccine and had underlying health conditions. We'd like to express our sincere sympathies and condolences to the family and loved ones of these people who have died. In terms of sewage detection, New South Wales Health's ongoing surveillance system for detecting fragments of the virus that causes COVID has detected positive findings in locations without known cases. These are Leeton, Lonbimby, Inverell and Uralla. So if you have been in these areas recently or live in these areas, please monitor very closely for symptoms, and if you get any symptoms at all, come forward for testing right away so we can find that if you've got COVID and make sure your community is protected. So with fully vaccinated international travellers returning to the country without quarantine from Monday, and regional travel and other restrictions easing from Monday, it's important now more than ever that we are very careful with our COVID-safe behaviours. It's vital that anyone with even the mildest of symptoms comes forward for testing and immediately isolates until you get a negative result. It's critical that we maintain high testing rates, particularly in the regional areas, including places where there are no known cases. Testing allows us to know when the virus may be circulating and gives us the ability to detect potential outbreaks and get them under control as soon as possible. So we continue to urge everyone who hasn't done so already to come forward for vaccination. Vaccinations are so important to protect us all, protect yourself from getting serious disease and from transferring the infection to other people in your family or your community. In this phase of the pandemic, the onus is on every one of us to keep each other safe, especially the most vulnerable. By vaccinating, you're protecting vulnerable relatives and friends. So please come forward for vaccination, come forward for testing if you get any symptoms at all. Wear a mask as required indoors. Practice physical distancing. Assume other people nearby might have COVID, and particularly in indoor settings. Use regular hand hygiene with either soap and running water for 20 seconds or one of the alcohol-based hand gel rubs. And always check in with the Service New South Wales app. Halloween is coming up soon, so it's important that you and your family are prepared and to have a COVID-safe Halloween this year. So aim to keep celebrations outside. Provide closed packaging for treats instead of communal lolly bowls. And consider ways of distributing treats that are safe, for example, putting them along the front fence or hidden in the front yard. And keep it local, try and stay in your neighbourhood rather than going to treat streets more wide afield. Don't let kids or yourself share any of the costume face masks. And if you're feeling at all unwell, or if your kids are at all unwell, please don't participate, and don't allow people into your house to celebrate Halloween if you are feeling unwell. And of course, practice good hand hygiene with soap and running water or hand sanitizer. So thanks very much for your continuing efforts in helping prevent the spread of COVID through coming forward for testing and, importantly, getting vaccinated. Thanks very much.